Hi, my name is Lynn Welliver. I'm a nurse at Salisbury Township School District, and today I'm going to discuss identifying substance abuse in adolescents. By the end of my presentation, you'll be able to discuss the impact that drug use has on our students, identify signs of drug use or students that are at risk for drug use, identify current trends in drug use, and know the procedure for reporting and what to do if you suspect a student is under the influence. Drug use is a common problem for 15 to 24-year-olds. By the time a student reaches adulthood, 50% have used drugs and 80% have used alcohol. There are many negative consequences to drug and alcohol use, including driving under the influence, unprotected sex, violence, crime. It affects growth and development. It affects learning and memory. There's an association between substance abuse and mental illness, suicide, and homicide. Medical consequences include addiction, overdose, STDs, HIV, stroke, heart attack, kidney or liver injury, seizures, and even death. And this information is important for faculty and staff to know about because 22.7% of high school students were offered, sold, or given drugs on school property. So it's happening right under our noses. Prevention is the most important measure. So we can identify a student who needs help and intervene early. So students who might be using drugs or might be at risk for using drugs will display a loss of interest or enthusiasm. They'll have frequent absences. They'll have late work or missed work completely. They'll have a negative outlook, be moody or tearful. Negative interactions with their peers. A big red flag is a change in their social group. And you'll see appearance changes, poor hygiene or inappropriate clothing. If they are using, you might see changes in their skin, like track marks or lesions from picking at the skin, which we'll talk more about. Now, the Student Assistance Program is a great resource. Anyone can refer a student, so it could be a parent, a teacher, or a student if there's someone they're worried about. And it's always better to err on the side of referring if a student is displaying behavior that's questionable. There is a process to determine if your concerns are warranted, and it's always better just to refer somebody than to let a student slip through the cracks. So the SAP team can get that student counseling or different referrals, crisis intervention, drug and alcohol treatment, or other interventions. And on your handout, there is a link for the SAP referral. So if you have somebody in mind, please do that. A student that's acutely intoxicated will display unusual or violent behavior. They will be inappropriate or defiant. Their emotions will be very volatile. Their judgment will be impaired. Their communication will be affected. They could limit the amount they're talking to you. They could be unusually talkative. Their speech might be slurred, or they could be speaking really fast. If you look at their eyes, they'll be bloodshot. And the nurses complete the drug impairment training for educational professionals, or the DITEP protocol. And we look at pupils, vital signs, and some other indicators to determine if a student is impaired. And we'll talk more about that later. Now, I can't discuss every single drug out there, but we're going to talk about some common, more popular ones that are going around these days. So this first slide is about marijuana and synthetic cannabinoids. Marijuana affects short-term memory. Students will have difficulty with complex tasks and a slowed reaction time. And when you look at their eyes, they'll be really bloodshot. And then synthetic cannabinoids have all those same symptoms, but then in addition, they can have agitation, panic attacks, nausea, vomiting, fever, sweating, dizziness, trouble walking. And synthetic cannabinoids are very dangerous because you can overdose from them and have some pretty significant medical issues. Seizures, kidney damage, heart attack. Also, it's not detectable on a urine drug screen, so if a student who might have to undergo drug testing is not deterred from using synthetic cannabinoids for that reason. Everyone's heard of the opioid crisis. There's two ways that an adolescent might be introduced to opioids. The first is voluntary introduction, where they take it to feel good or to self-treat an underlying social or mental health problem. Accidental introduction is when an adolescent is given a prescription to treat pain, and that's usually after an oral surgery or an orthopedic surgery at this age. Types of opioids include heroin, fentanyl, codeine, morphine, oxycodone, and hydrocodone. And you'll see pinpoint pupils, drowsiness, warm, flushed skin. Opioids are especially dangerous because of the overdose potential. The hallmark of an overdose on opioids is known as respiratory depression. So somebody will be breathing slower and slower and ultimately can stop breathing altogether. Now, Narcan is the reversal agent for opioids. It has a very short half-life, so multiple doses of Narcan may be required till the opioid actually wears off. And we do have Narcan available at each school. Withdrawal from opioids can cause flu-like symptoms, agitation, anxiety, and a crawling sensation on the skin. And so that's part of why opioids are so addictive, because the withdrawal symptoms are so unpleasant. Next, we're going to talk about amphetamines. I have this divided into 3 different categories. There's prescription amphetamines, there's methamphetamines, and then there's synthetic amphetamines. So the prescription amphetamines are prescribed for people who have ADHD, and people who take those medicines to treat their ADHD do not get addicted, and they don't have any of the symptoms I'm going to talk about. It just treats their condition. So prescription amphetamines were initially abused by college students who were taking them to stay up late studying or to take to aid in weight loss, because it does have an anorexic effect where you don't eat. So symptoms of prescription amphetamine abuse include agitation, hallucinations, and you can have seizures from it. So methamphetamine is known as speed or meth, and it's very addictive. So someone might start taking with low doses, and you get increased alertness, increased energy, a euphoria, increased self-confidence, increased activity, increased strength, and really talkative. And then as you get more and more addicted, you need high doses. And those symptoms are violence, tremors, tics, dry mouth, slurred speech, agitation, paranoia, and a crawling sensation on the skin. So this is where you'll see those skin changes from picking at the skin because of that crawling sensation. And then the synthetic amphetamines are bath salts, Vanilla Sky, Bliss, Meow Meow. So a lot of the same symptoms of methamphetamines. You'll also see pinpoint pupils, sweating, pale skin, and you can have seizures from this too. And it can be snorted, injected, or mixed with food and drinks. So vaping is really popular right now, and vaping use continues to rise among teens. Vape devices can be used to deliver nicotine and many types of drugs. So watch out for any of the symptoms that I talked about earlier. Um, Other hints that someone might be vaping around you. You might have an unexplained sweet scent. Students might have dry mouth or frequent nosebleeds. And many vape devices are designed to look like school items or camouflaged in ways that they're not quite as noticeable. And popular Google searches right now include stealth vaping and hiding Juul in school. First off, if there's an emergency, call 911, call the nurse's office, call the main office so the nurse can respond. And if you're not sure if it's an emergency or not, you can always call the nurse to respond to a student first. Um, Always err on the safe side. But if no emergency is suspected and you suspect a student is under the influence, contact the school resource officer or administration and they will escort that student to the nurse's office. And the nurse will assess the student using the DITEP protocol, which I mentioned earlier. So the nurse will determine if the student is impaired and is there a medical concern or is this impairment drug related. And the nurse might even be able to narrow down the category or categories of drugs used based on the signs and symptoms that the student has. And also the nurse can determine if further medical treatment is needed before the student is released to administration for disciplinary measures. So as faculty and staff, you're in a unique role to notice changes that occur in a student because you see these students every day. You know them pretty well, and you can tell when something's off. Don't forget about the SAP referral for students you're worried about. It's always better to over-refer than under-refer and let a student slip through the cracks. Sadly, adolescents are especially vulnerable to drug use and dependence. So we'll work together to recognize a student who needs help and make Salisbury a healthier and safer place and facilitate learning for our students. And here's all my references. And I'll take questions now. Thank you.